Hi everybody, very anxiously saying hi today because as you can see, when I walked into the office this morning, my staff were like, what did you do? So as you can see, I've shaved my scalp and I actually had a hair transplant. I went back to Europe to see one of my very, very good and dear friends who's a surgeon. I trained with him and he kindly did my procedure for me. And at some point, we'll do a live interview so we can talk more about that. You can see, from his perspective, what he did, etc. But I've been thinking for a long time about doing a small procedure. If any of you know from my previous videos and meeting me, lots of patients thought for somebody in his early 40s, my hair was quite good. Well, mid 40s now, 45 last week. So anyway, I wanted to do something now because I think small bits of surgery done earlier are better than waiting, until your forehead's really high or you're quite thin. So a little bit about me from my journey as a patient. And this is not medical advice for all of you. Everyone's different. Go and speak to your own doctor or surgeon. So I started off on some finasteride, which is the main medication that people first start on when they're diagnosed with androgenetic hair loss. And then from there, I wanted to be a little bit more aggressive. I went on to dutasteride and I was personally fine and I'm still on dutasteride. About 4 years ago, I saw one of my very good colleagues who's a dermatologist, Dr. Jaggi Rao, and he recommended going on to oral minoxidil. And then most recently, I started off on some oral minoxidil as well. Started off on 0.625 milligrams and then titrated my way up to 3 milligrams where I'm now. So for the hair, I'm on 0.5 milligrams of dutasteride and 3 milligrams of oral minoxidil. Topical things, I don't really do much. Because I'm quite forgetful, but that's just me, being very honest. And so it's getting a little bit thin, and I think what really made me want to go and do it was I normally have my hair longer, and the front was looking not too shabby, the front was getting a little bit thin, but when I was actually styling it back, there wasn't much support behind the hairline. And the writing was on the wall really, because at times my barber would say, well, wow, it's getting a little bit difficult to do the hair that you normally wanted it to be. I think my staff here felt it was very important to be transparent because a lot of our patients often are very brave and they'll put their story forward to educate other people who are going to go through this procedure or considering it. And so they thought it was important to be, sing from the same hymn sheet and show you guys this monstrosity of a haircut. So I had the FUE procedure done. My lovely friend Arthur, he did just over 1,500 grafts. Like you guys, I walked into the office and we planned it. And on the actual day, I asked him if I can do 2,500 grafts. And he said no. Like I always advise all the other patients, is do a smaller amount, be conservative. And, a small surgery done well will last you actually quite a long time. And obviously I have to make sure I maintain all of the medications and things, or else it's pointless in terms of, maintaining the bigger picture. So yeah, this is me at day 8. The surgery was done last Tuesday. My experiences of the surgery as a patient, fine. The anesthesia was fine. It nips a little bit, but it is what it is. I personally asked to be prescribed some diazepam because I wanted to sleep or be more relaxed. The surgery was around 8.5, 9 hours. The team were very, very good. I did have some swelling afterwards, but it was quite minimal. I checked into a local hotel. Personally, on day 2, I went out for dinner with Arthur and his partner, and that was really, really nice. We had a really good walk around the city. It looked like I had brain surgery, but I was fine. And obviously I was keeping up to date with all the spraying and everything. Day 3 to 4, I think I had some discomfort around the donor area, and I just took some ibuprofen and some paracetamol, or Tylenol as you guys call it. And then on the flight back, that was fine. I just made sure that I, covered the seat in a sterile pad, the one that we normally give you guys post-op. So yeah, here I am. I'm going to start back at the gym in 2 days' time. And what do I feel at the moment? It's a little bit tender in some areas, to be honest. It's quite scabby in the front. I'll show you guys a closer look once you're a little bit closer. A lot of people are like, why did you get this done? Like, your hair was fine. But I could see it, and when you come closer, you'll just see what he's done is he's reinforced the hairline, and he's also scattered some grafts into the mid zone, and that was really where I was feeling quite thin and bare. So I'm really, really excited to see the results. The most traumatic part for me was actually being shaved, because my hair was quite longer, and that was quite a drastic change, because when you suddenly see this ginormous forehead and scalp, you're like, my goodness, wow. But actually, I'm actually quite fine with it now. I mean, I'm showing the whole world. I've never done this before, and I feel, it is what it is. There's only one way to make an omelette, and you have to break the eggs. I could have done this with longer hair, but I chose not to, because obviously, I feel you're going to get more density, and also I didn't want to be sitting in the, surgical chair for like 12, 14 hours, because it really does elongate the day a lot longer. So yeah, this is a very candid video. I'm not going to edit it or sort of show you guys some dancing, happy, clappy doctor like everyone is on TikTok these days. I just think a lot of people just want transparency, very candid community. And how does it feel to be saying this to all of you? Well, it feels quite vulnerable, to be honest with you, because obviously there's always an image that we all want to portray to the world. But, I think at 45, I started doing small tweaks to myself when I was 28, but I always felt that people who think about the next 10 to 15 year plan are always going to be ahead of the crowd. It's a personal choice. So I think good skincare, take care of your body, go to the gym, and take